All tight. All right, you're on.
Hello, everybody out there in cyberspace. This is Dr. Tom Harvey coming at you live with Dr. Greg Proangeli and Cheryl Jose. And we today are going to perform Lipiflow. And this is a treatment that's been around now for several years. I've been performing it on our patients with dry eye and ocular surface disease. And I've reached a point now in my life that I feel that it will very likely help me. I'm already doing all the things that I think are helpful for dry eye, including medical grade fish oil and lubricating drops, but I need a little help with my eyelid edges down. This is exactly what Lipiflow will do for us. So the plan for our procedure today will be for Dr. Proangeli just to put in a little numbing drop in each eye, and then the activators will go in. They'll put a little tape between the two activators across my nose so that everything stays perfectly positioned, and then we can go ahead and do the treatment. It only takes about 12 minutes, so stay tuned.
All right, here we go. Just placing the anesthetic drops.
That's great. And it's amazing how minimal the numbing drop stings.
A little sting.
Only a little. Dr. Proangeli is really
All right, go ahead and look down for
good.
me.
And we're using the new activator. Is that correct, Cheryl?
Actually, we're using the Activator 1 today, but there is an
Uh-huh.
Activator 2 that was recently released.
Okay, wonderful.
And it's the same, exactly the same function, but the Activator 2 has a disposable piece to it, so the actual activator itself is disposable, and the cabling is a part of the Lipiflow semi-permanently, so that's the only change.
And here's a little bit of tape we'll put in place to
Good.
help hold it.
Sure.
It's
And
right to the
so
bridge.
the activator is vaulted above the cornea. It does not touch the front of the eye at all.
I like that. And so
Okay.
this is
And then we'll
years
take
of
this
engineering in the making, because
Yes,
there's
it
actually
is.
a warming element as well as a pneumatic element that does the massage and helps move these glands along. And so basically what I always like to do is to have them positioned and make sure the patient's comfortable and there's no tightness or pulling, and then we can start the machine and let it do its thing.
That's right.
Okay, go ahead and look down toward your opposite knee here.
So the activator actually heats to just 10 degrees above body temperature, and that's at 108.5. So
Good.
that is the warmest that it gets.
Good.
Okay, go
That's
ahead and
So
great.
raise
that's
your
what
eyes
we
a
need
little
to
bit
melt
for
that obstruction, which is the root cause.
Nice,
Okay.
nice.
Get my tape there.
Sure. You know, this is amazingly comfortable. I have to tell you, I
How do you feel?
feel a little bit like I'm going in for a spa treatment in a weird way, except this is not slices of cucumber or whatever you ladies put on there. This is some high-tech medical
All right.
machinery. Okay, good. So what I always do is to make sure that the eyelids are comfortable around the white part of the activator. So that sometimes means just lifting up on this piece just a little bit to make sure there's no white exposed except around there. Am I doing pretty well on the...
Looks good. You may want to just pull on that upper lid just a little bit
Yep.
before we
Uh-huh.
start. We'll kind of pull it down
Thank you. Oh,
So-
yeah.
off to the side a little bit.
Good.
There you go.
Good.
Oh, yeah.
And then the other eye as well.
Yeah.
And then we can start it.
Yeah. This lateral motion here is good just to kind of make it snug in there nicely. I'm excited. I'm getting a chance finally to see what my patients have been enjoying for years.
Are you ready to start then, Dr. Harvey?
Let the fun begin.
All right, so
Ooh.
we will be in the room with you the entire 12 minutes. If you need us to, we can pause the treatment at any time.
Right?
Right now, you're going to feel just a little bit of pressure and some mild heat, and we'll let you know when it gets to 108.5, which is the maximum heat.
Oh, wow. I love it. Oh, it feels good. It's basically just a little bit of sort of a snug pressure, no more than what we do when we rub our eyes, but the pneumatic effect is amazing. And it's not the same on both. It's sort of, I can feel a little bit first left then right.
It's a little bit different because when we place the first activator in, it acclimates to your body temperature.
Mhm.
So there'll always be a few seconds in between each eye.
Wow,
in
feels
the treatment.
good. It's warm. Excellent.
So 105 degrees is not too warm for your eyes.
So 108.5 has been found, that's
108.5, okay.
during their studies, that's what they found to be a heat that was safe for the cornea, yes.
Yeah, and that concept comes from the melting temperature of the oils that are in these glands. I mean, the upper eyelid has 20 of these glands or more, a few fewer in the lower eyelid, but they have to be brought to a warmer temperature. And that's really not the easiest thing to do, because anything that we apply to the front of the eye on the skin does nothing really to warm the underside of the eyelid like this can do so efficiently, kind of keeping the heat shielded and right in the tissue itself. Of course, the glands are much longer in the upper eyelid, so it has to fit exactly right to have the desired effect. And then once they're melted, turning the rock hard butter into olive oil, they can just be expressed with the pneumatic massage that this thing does, kind of like how we would milk a cow, if you can imagine that. The farmer in the old days kind of pulling the udder down to get the oils out. Well, in this case it's oils, not milk.
And this is the only FDA cleared treatment for Meibomian gland dysfunction, which is a chronic and progressive disease. So removing that obstruction is the root cause, whereas any pill drops or drugs don't address the obstruction. They only address the symptoms. And we use those post-treatment. The doctor will recommend, so Dr. Harvey, you'll have to find something that you can use as far as omega-3s and different supplements that will actually extend the treatment of the efficacy of the Lipiflow anywhere from 12 months to 36 or more months. That's what the FDA study showed.
Yeah, we've seen data to support that a single treatment will last 5 years and beyond to improve tear film stability. I was actually a panelist on a session that was presented last year, just those very facts, and it's remarkable to think that having something done like this can last that long. But honestly, I probably needed this a long time ago, and to have the oils kind of freed up so that the flow can be as Mother Nature desired is probably the best thing to keep them comfortable and happy, as opposed to those glands that are clogged and then they become a container of sludge which the body doesn't know what to do with other than to attack, and then we actually can lose glands over time just with that inflammation that results.
And this is what our Meibomian glands look like. This is an example of a mild gland structure. So this is the lower lid, and you'll see the white line is actually the gland itself, the Meibomian gland, and that produces the oil that we need for a healthy ocular surface. And so when these glands become obstructed by the oil, it becomes hard, almost keratinized like a fingernail. And then if the glands, for many different reasons, if the patient isn't a good blinker, they're not meeting their lids together, these oils can express into the tear film. And the glands are not functioning, and what they do is they will shorten or truncate. They'll start to shorten, and then they'll atrophy or die off altogether. And when that occurs, we can't get that structure back. So we like to address it sooner than later for best treatment efficacy.
Can you describe what you're feeling right now, Dr.
Yeah,
Harvey?
it's almost like kneading dough. That's what it feels like right now. So it's sequentially putting the clamps down on the edge of the eyelid. It doesn't hurt at all. It actually feels really good. And it's just getting all the oil expressed in sort of a sequential fashion. It leads with the left side, then with the right, just half a second later. Feels really good.
So who is a good candidate for this treatment? What kind of patient should have this?
Yeah, the people that I think are best for Lipiflow are those that have a good understanding that this is something that is an inflammatory, age-related condition that has, I guess, potential for improvement if action is taken before it's too late. Because when we lose the glands over time, there's no way to bring them back. So those people that are aware of this and understand that this is something that I'll have to deal with as time goes on, why not in the short term go ahead and approach this? Certainly people that are not afraid of having their eyes touched are appreciated, but we've had some very nervous, squeamish people do really well with this. Not all forms of ocular surface disease or dry eye are really going to be gland related, although in my experience most are. So it's most forms of dry eye and eyelid edge inflammation that would benefit from Lipiflow.
And so now we're finding with younger and younger people, we're all on our phones, we're on our computers, we're just not blinking like we should be. And so we're finding younger and younger people that actually do have this type of gland loss. I mean, we're already seeing children, you know, on game systems and iPads that already have gland loss. And we need our glands so we have that healthy ocular surface. So it's very important to educate everyone that this is a chronic progressive disease, and younger and younger people are involved. And it's good to go to your doctor and be evaluated and get your Meibomian glands checked and your gland function. That plays another role in it, what your glands are producing as far as oil.
That's a really good point. And I know that not every eye doctor or clinic has this machine available, so sometimes patients come from a long distance to have their ocular surface evaluated, and that's a test that will be very worthwhile because we can determine what is causing the irritation. Sometimes it isn't even dry eye at all. It could be something allergic or perhaps even an infection in some cases, and sometimes treating that avoids needing any intervention at all. So it's worthwhile to have that evaluation, as Cheryl said.
Is this something that you just do once, or do you do treatments more than once?
So this is a treatment. Once you have been diagnosed with Meibomian gland dysfunction, it's a chronic progressive disease that you'll have for your lifetime. But the treatment efficacy, as we discussed earlier, is anywhere from 12 to 36 plus months. And patients that have the Lipiflow treatment, the FDA study showed that they have 2 to 3 times gland function improvement. So those glands that are producing those oils we need are producing more oil, and we're getting them working again to stop that progression of the disease. And that's our whole goal: remove the obstruction and get them functioning again. And again, the patients doing their homework at home can get that treatment to lengthen out to, like Dr. Harvey said, he's seen patients up to 5 years. So it's a very effective treatment. Patients with severe dropout or gland atrophy, what we want to do is remove the obstruction and maintain their gland function. They may not have the same symptomatic relief that patients in this area, in the moderate to mild area, may have, but we do want to maintain structure so they don't continue to lose those glands.
What kind of symptoms does someone have when they have this gland dysfunction?
Oh yeah, great question. A lot of times it's sort of inconsistent vision, or vision that will blur out because the tear film is not stable and it'll slide away or evaporate. So that's one common thing that we hear about. But a lot of times it's greediness, irritation, occasional itch, and redness. So it can present in a variety of ways. For me, it was always just sort of a little bit of end of day irritation, and with Meibomian gland dysfunction and dry eye, it's not all that uncommon to hear about some of the dryness stuff later in the day. Some people that have predominantly eyelid edge inflammation problems will have symptoms more first thing in the morning. They'll say, oh, my eyes burn when I wake up in the morning. It's a burning feeling. And this will also help those folks as long as they have the complementary medication or supplements that we were discussing earlier. This is doing that little kneading massage thing right now. It feels so good.
So there are about 45% of patients that may not even have symptoms. They may not even know they have Meibomian gland dysfunction. So with those patients, it's really important when you go into the doctor to have a comprehensive exam, to have your glands imaged, and to check your gland function.
Got 1 minute left.
So can we get a double? I want to do this again.
I'm sure we can find someone that would like to have the treatment.
It's much like the pneumatic chairs that give you the massage on your back, except this is massaging my eyelids. I love it. So what can we expect with the new activators? Will they be the same size as
Exactly the
what we've
same,
come to
yes.
know? Okay, good.
Mhm.
It's just how it connects to the machine.
I
It'll be-
actually have one here that I can show you in a few minutes.
Okay. That's a good thing to know. I mean, when this is in there, these little things that protect the eyeball, they don't allow me to see anything in the outside world. So basically, I'm in my own little relaxation state without a whole lot of sensory input other than what I can hear.
So it comes in the exact same packaging as the Activator 1. It's all sterile packaging. And the cabling will now be semi-permanent to the Lipiflow. And it's actually locked in with a clip mechanism. And what happens is all you need to do is this activator will be inside the packaging as such, and then you just place it on here, and you're just ready to go. And it's all sterile and ready to place on the patient's eye. All right.
Okay, we'll turn the light on and we'll go ahead and remove. Again, totally painless. There's no pain to this at all. Take this one off first.
Okay.
Your right side.
Sure.
So just go ahead and look down for me.
Sure can.
And it just comes right out, just like
Look at
that.
that. Like butter. Hello, world. I can see you.
And I'll just repeat it here. Look down. And it literally just falls
Wow.
out. So there's,
Easy.
Wow.
it is very easy.
Hello. Have you been here the whole time, Ann?
So now everything that Dr. Harvey, all the oil, the obstruction is gone and it's drained out.
Mm-hmm. I'm feeling good. One of the things that I notice after patients have Lipiflow is how much thinner the eyelid edge is, because those people that are obstructed, they just become thicker and thicker. It's almost like constipation of the glands. And that really is relieved. And I don't know if my eyelid edges look thinner, but they sure feel better. Wow.
Awesome. All right.
Thank you, guys.
Thank you.
Thank you.
Signing
Thank you.
off from Independent Surgery Center.